Hello, everybody. Welcome to our little get together. If you haven't met me before, I am Dr. Lillian Rocha. I'm the CEO of the Behavioral Web. You're here on my channel, and it's my great pleasure to introduce the team at CGI, Cummings Graduate Institute. And we are here to talk about DBH's Doctor of Behavioral Health and how we can and have been disrupting healthcare and improving healthcare, and specifically how this institution that's here in my heart, Cummings Graduate Institute, is really promoting change and access to people in different parts of the country and with different interests. And so it's my great pleasure to have you all here. A little housekeeping. We have about a 10-second delay from whatever you type in the chat box until we get to see it. So sometimes we may ask you a question or you may ask a question, and it may take a few seconds until we answer. But please, type away in the chat, say hello, say where you're from, where you at right now. If you've met a DBH before, if you've heard of CGI before, let's make this as interactive as possible. All right. And without further ado, let me introduce Dr. Kara English, who is the CEO of Cummings Graduate Institute.
Thank you, Dr. Rocha. It's nice to be here. I appreciate the offer and the opportunity to come on to the Behavior Web's live conversation today. So Dr. Rocha has asked me to give a little bit of the history about Cummings Graduate Institute for Behavioral Health Studies. And it's one of the things that I'm very passionate about. So thank you for giving me something that I really enjoy talking about, Lily. So Cummings Graduate Institute really started as the Doctor of Behavioral Health program. And the history of the Doctor of Behavioral Health program started, really in the 50s when our founder, Dr. Nicholas Cummings, was going through his own medical school training as a psychologist, and then the very fierce and pretty savage training he had as an Army medic. He was actually part of the Air Force Airborne at the time. I see Pauline. Hello. And so there, through that experience, he had a really unique opportunity to learn how to impact positively a person in 3 seconds or less. And the psychological skills that he gained through that experience in intervening, the Air Force actually gathered all of the world's best psychologists and psychiatrists so that they could train those medics in the airborne to help the paratroopers to make the choice to jump out at the correct cadence, because about 1 out of 3 were having a panic attack in the air prior to that, and they were dying because they had forgotten their training and they weren't making it safely to the ground. So through that training, he literally learned to talk a trooper out of a perfectly good airplane in 3 seconds or less. And after the war, he established a private practice, but very quickly became very frustrated with the number of patients he felt he would be able to impact throughout his career. And so he began a career instead at the Kaiser Permanente group in California, working with Sid Garfield there. And the two of them had a really interesting and very innovative way of looking at the relationship of behavioral health as part of medical care. And so years and years and years before the term integrated care became something, our founder, Dr. Nicholas Cummings, was studying and writing prolifically about the critical need to incorporate psychological care as a part, absolutely, of holistic healthcare. And this is something that he passionately advocated for. He taught about this. He wrote, as I mentioned, prolifically lots of books and articles about this. and he studied the medical cost offset of integrating medical care into, behavioral health care into the medical care or primary care for populations. And what he really saw at the time was the extreme costs that were involved when the behavioral health aspects of any person's care are ignored and are not considered as part of a whole human being who is standing in front of you with all of their human needs, motivations, drives. And so, just for a couple of examples of chronic diseases such as diabetes and cardiovascular disease, there's a huge behavioral component that we all know is part of those chronic diseases. And when a person has that diagnosis, it's a pretty big emotional deal to be given a chronic health disease diagnosis. And to continue to be able to treat that well, you really have to take a look at the emotional aspect of caring for yourself on a day-to-day basis and the behaviors that lead to optimal health outcomes or good outcomes, the positive things that we want. And then also on the other side, the behaviors that would lead to poor outcomes. And so nutrition and physical activity are obviously part of that. But in addition to that, Dr. Cummings was seeing a lot of what he called somatic, or he called patients who had physical complaints that were really rooted in emotional or psychic kinds of conflict. So he kind of named that kind of patient a somatizer, and he really developed evidence-based practices to help an individual resolve those kinds of conflicts, which were in many cases completely unknown or unrecognized to the individuals that he was treating, while at the same time educating physicians about how effective psychological care could be when it was integrated into medical care. And so over the years, as you can imagine, he was seeing that in psychology programs, doctoral level psychology programs, and then the growing master's level degree programs, this was not at all part of any of the training that any of us received. And this was true all the way up until the Doctor of Behavioral Health was born. And so Dr. Cummings really advocated and sort of used the Institute for Healthcare, or excuse me, the I believe it was the World Health Organization, but it might have been the American Medical Association as well. I'm forgetting the exact reference at this time, but it was called the Bridging the Quality Chasm, and it was published in the year 2000. And Dr. Nicholas Cummings saw that they were specifically calling out the gaps in training for medical residents, as well as, and he saw the complete connection to the gap in those areas for psychology residents or behavioral health trainees. And so he began to really advocate for an updated training program that integrated medical training and behavioral health or psychology training, so that we were able to really see the whole person each and every time they came in for primary care, and to be able to really address the issues all under one roof. And again, like I mentioned, he started to really look and dig deep and look at the data behind the cost of care. And the difference was incredible between care that was integrated with behavioral health as part of regular medical care under one roof versus disintegrated care, where an individual would be given maybe a referral by a physician to go elsewhere to see a behavioral health clinician. And the data on that, not only did it show that 80% of patients never followed up on that referral, but it also showed that when a patient didn't follow up on that referral, it was primarily due to either time or convenience or transportation, many of the issues that we now know are social determinants of health, but also that they really did prefer for all of their care to be delivered under one roof. And then additionally, those who didn't follow up on care ended up having poorer health outcomes overall, and the cost of their care was extreme. And so there's a concept in the medical world that is called the 1%, or 1% of the population has by far 50% or higher their share of the cost of the healthcare dollar. And the reason for that is that there are individuals whose care is very complex, and they may have multiple chronic conditions, including multiple behavioral or emotional or psychological conditions, and extreme social determinants or social disparities of health. And for those individuals, because their care is so complex, it is inevitably the most disintegrated care. And so they're trying to be sort of shuttled around between silo to silo to silo. They're being sent for a whole lot of different tests, likely being prescribed a whole lot of different medications. And yet all of their care is really put on them as the burden of the bearer of the disease. And so the medical cost offset research that he published was really groundbreaking. And with that, he really leveraged that the data suggested a new training model. And so he really started to advocate for the Doctor of Behavioral Health program, which he tried at a couple of different universities. The most recent one prior to starting his own institute was at Arizona State University. And there are some of you here I know who have gotten your degree. I also, Dr. Young and I both got our degrees at Arizona State University. And Dr. Cummings and his daughter, Dr. Janet Cummings, who teaches all of the medical literacy courses in the Doctor of Behavioral Health program, got to a point where they realized that, like many universities, the focus is so broad because you're looking at undergraduates, you're looking at master's degree level students, you're looking at doctoral students, but the doctoral population is a lot smaller, and most of the focus of a university's efforts and funding is really focused on the undergraduate population. And he really wanted to form an institute that could completely and solely focus on integrated care because it just wasn't gaining steam and momentum to the degree and pace that he would like to see it. And it was his lifelong dream to have his own. He wanted to leave a legacy of having his own institution. And so he founded, with his daughter in 2015, Cummings Graduate Institute for Behavioral Health Studies. And our flagship program is the Doctor of Behavioral Health, which he and his daughter, Dr. Janet Cummings, developed the curriculum for based on his many years of clinical practice and medical cost offset research. So the Doctor of Behavioral Health program, and I'll turn it over to Dr. Young here in a minute to talk about our Doctor of Behavioral Health program at CGI. But we have 3 pillars, and those 3 pillars are not only the kind of integrated behavioral health interventions that are different from what you would see in a traditional private practice or a community behavioral health practice, because they need to be delivered in very short time periods that are, part of the very quick-paced primary care environment. But we also have entrepreneurism, so being able to take an idea from start to finish, including what the finances look like and the return on investment analyses, and medical literacy. So that's what Dr. Janet Cummings really always specialized in. She too went through medical school training and then decided to go the direction that her father had led and pioneered in by becoming a psychologist. So her specialty is psychopharmacology, pathophysiology, and neuropathophysiology. And so those 3 classes, the Cummings family has always felt that in integrated care, a behavioral health practitioner becomes more like a medical practitioner, and the medical team who works shoulder to shoulder and side by side with us becomes more like a behavioral health practitioner. So we learn together to wrap our arms around each and every patient as well as the population at large, so that we can really deliver the optimal care and work at the top of our license. Mm-hmm. And so I'll stop there because I've been talking for a long time. I wanted to see if there were any questions. And I will say that Dr. Grant Baldwin is trying to enter, but right now he's just getting a black screen, Dr. Rocha.
I don't know what it is because It tells me here that he's connecting, so it may be taking some time.
Okay, I'll let him know, but I'll go ahead and mute so that Dr. Young can talk a little bit next.
Before Dr. Young speaks, I would like to remember everybody of this little green button that you have at the bottom of our screen. That's for you to please click and donate to this wonderful institution. Today is Arizona Gives Day, and we're here to help this institution continue being such a low-cost institution. You know, I can say for myself, I am a graduate of the CGI, Cummings Graduate Institute, and I benefited a lot from the donations from this day. I had the opportunity to be awarded scholarships during my education because people donated. And because I graduated, I now, no humility here, I do an awesome job with people across nations. I actually work in 2 countries at the same time. I am a way different clinician and thinker than I was before my school. And I know that people are benefiting from what I got from the donations on this day. So please click there and donate. And when it's over, share the link with your friends and ask them to donate too. Now, Dr. Young, please. Can you tell us about the status of the CGI programs now, what we're doing now at CGI?
So actually, hi everyone, I'm Dr. Young. I am the director of the Doctor of Behavioral Health program at CGI. Before I actually get into that, I would love to know if you guys have any questions. So I'm pretty active in the chat right now. So while Dr. English was speaking, I was trying to answer as many questions as I could. If you could please just type your questions in the chat, and I will make sure that I address them as I see them. And any question, don't think it's too small or too big. So you have Dr. English and myself here, and I think and Dr. Rocha. So between the 3 of us, we can answer it. Well, one of the things that I will say first before I even get into what we're doing at CGI now, I will say that I have taught at other universities. And one of the things that I have loved about CGI is the space to create an intimate relationship with the students. And we do that in so many different ways, but one is the small classroom sizes. I think it's important to say that because a lot of students come in, especially, you know, after not having been in school for a while, if you're coming back into a doctoral program and you've had your master's for a while, it's important that that I let you know how much support and connectivity you have with the faculty and the administration. And I say that because when I'm interviewing them to come into the program, that is a huge question. So I haven't been in school for a while. How much support will I have? Am I just coming in? Am I just enrolling in classes and then just having to go through it all by myself? And one of the things that I would say is that we try to encourage our students to build relationships with one another outside of the classroom setting. But then apart from that, we try to make sure that our faculty just maintain that relationship with their students. And so students feel comfortable reaching out to the faculty. All students are assigned an advisor upon entry. And so before you even take your first course, you will be provided with an advisor that can answer questions for you prior to you even starting classes. And I think things like that are important to mention because there can be some anxiety about going back to school. I know I had it. I waited to get my doctorate after getting my master's. I was one of those people, I was like, I'm not getting my doctorate. I don't need my doctorate. And it wasn't that I didn't want it. I just hadn't found the program that was for me. And so when I found the DBH, it wasn't online yet. And it was where I would have to go to Arizona to complete it. And I was like, well, I can't do that because I had a business and I had things going on. And then as soon as the program became an online program, I jumped on it and I was like, yes, this is it. And so again, I had that hesitancy, but getting in there, I had that anxiety like, oh my gosh, I haven't been in school in a while and this is going to be difficult. And so I didn't necessarily receive as much one-on-one support in my program. But one of the things that I love about CGI is that we make sure that people are first and people come first. And so we try to make sure that we, just provide that setting and that environment for our students so that our students feel fully supported. So that's now I will answer the question. So right now, one of the things that I love that we're working on is we're always adding additional courses. So let's start there. That's another thing that's wonderful about the school. Our students, although they are in the DBH program, they have specific specialties and topics of interest and areas of interest. And so, for example, we have some students that recently expressed that they are interested in suicidology. And so what did we do? We created a course. And so that course will be offered this summer for those students. And so if they take that course and they feel like, yes, this is something that we love and we actually want to take another course, then we'll look at adding an additional course, just based on what they're interested in. Because the doctorate of behavioral health is so new. And I think we as CGI, we want to make sure that limits are not placed on the degree. And so we try to expand it as much as we can and show our students and show the world that doctors of behavioral health belong in all settings. We shouldn't be limited. We shouldn't be confined to just a specific medical practice or in private practice or in an FQHC or anything of that sort. We can be anywhere. And so recently also we had a student that expressed to me that she's interested in sexual health. And then interestingly enough, I was doing a faculty evaluation and I told the faculty member, she's like, oh, sexual health, I want to teach that. And so I love how we're able to just constantly evolve. And so that's what one thing that we're always doing is adding courses, adding different topics of interest. Right now we are adding specialty tracks for our students. And so that will actually start in the fall. And what specialty tracks are is, again, students come in, they may have a specific interest. So we have some students that are more interested in the program and policy development side of healthcare, and they're not necessarily practitioners. And so for them, we will have a policy and program development track that they will specialize in while they're at CGI. And so they will take the core courses, but then for their elective courses, it will be specialized around what they're interested in, which is the policy and program development. And so in addition to policy and program development, we will have an entrepreneurship track. We will also have, we're looking at adding additional tracks. We have some students that have expressed interest in women's health. For now, we have added certifications that students, non-degree seeking students can enroll in, and our students. So if they are a student and they have a specific interest in a certain topic, they can also receive a certificate in that specific topic. And so we're just, I think, just always trying to meet the need and fill the gap. And so wherever we see that, there's a topic that, hey, a DBH will be great in that field, or a DBH, we don't have enough DBHs in that field. So let's train our students on how to be in that field to fill that gap, because there are gaps. I feel like DBHs, and I think Dr. English and Dr. Baldwin and Dr. Rocha will agree with me, DBH can be anywhere because we're just that amazing. And the skills that we acquire teaches us how to be anywhere. And I mean, if you think about it just as a clinician, and Dr. English alluded to this earlier, we're not trained to work in primary care, the fast pace, the different setting. We're not trained to not be the boss. When you're in your master's program, you're trained how to be an individual provider working by yourself, running the show. And so what we do in the Doctor of Behavioral Health program is we teach you how to work in an interdisciplinary team, because we're not taught that in our master's program. We teach you how to work in primary care. We teach you the language. We teach you how to, just build that relationship with that primary care practitioner and others. And so I think it's just unique within itself. And like I said earlier, I thought that I didn't want to get my doctorate. And then when I found the DBH program, I was like, this is it. This is me. This is what I want to do. I wasn't a person that wanted to just do research and write. I wanted to be active. I wanted the practicum portion. I wanted to be able to apply the skills in the field. I wanted to be able to work with patients. And so I know I just gave a whole roundabout view of where we are, but in a nutshell, we're just constantly expanding, and we are pushing those limits and those boundaries constantly, and just trying to show the world how much DBHs are needed.
Yes.
In a nutshell.
I think it's amazing the diversity of subjects that we cover in a course of study.
Yes.
And I see Pamela asking questions about, so is there room for people to do faith-based therapeutical training? The answer is yes. If you find a gap, we'll help you fill it. Yes. I can tell you, when I started the program, my training was as a behavior analyst, and the field of application, although it could be so wide, is very limited in the real life, in the practice of a behavior analyst. And I end up, learning so much. My culminating project was on polypharmacy in psychiatric settings. So it's not something that I would think I would ever do in a different program. So if you're curious about something, go dig it, and we'll help you figure it out, and we'll help you put it out there for sure. And I'm so glad that Dr. Baldwin finally was able to join us. So thank you. Welcome to our little party. Dr. Baldwin, can you introduce yourself and let us know about future happenings at CGI?
You're on mute.
Unmute your microphone, please.
Thank you. My name is Dr. Grant Baldwin Jr. I am the Assistant Director of Academic Programs at CGI. The future of integrated healthcare is bright and broad and have many opportunities. As you heard the other speakers say, there's just the capacity just to grow in all areas. Becoming a DBH was probably the best decision I've made, because in the beginning I was just a practitioner. And like Dr. Young mentioned, just train really to be your own person. But this becoming a DBH made me what I would call a provider in a medical setting. As a master's social worker, I did not have the medical literacy or training to really, or educational background to really work in a medical setting, period. This program, this concept that Dr. Cummings introduced really caused me to grow into areas that I didn't even know I had strengths in, even in entrepreneurship. So becoming a DB and the courage and the tools and the information to really step out beyond my comfort zone to become a leader in integrated healthcare in North Carolina. With the skills that I gained as a DBH student, was able to bring and develop chronic disease management programs that were behavior healthcare based, increasing access to thousands and thousands of patients suffer from chronic medical conditions that were being exacerbated by mental health disorders. And that was for a lot of uninsured patients as well, from different ethnicities, different backgrounds, socioeconomic backgrounds. Also gave me opportunity to work on policy, being a member of work groups with the North Carolina Institute of Medicine, and actually sitting down with the leaders in the state and pretty much leaders in medicine, leaders in politics, were all there. Along with other professionals, and we were able to provide more insight as a DBH in how North Carolina wanted to introduce this integrated concept a little bit further and get a better understanding. So being the DBH gave me an edge. It gave me an edge in completing so. And basically the skills that I developed pretty much gave me, leadership roles automatically because I got a chance to exhibit, what I knew, what I picked up, what I was able to quote unquote soak in as a student in all. This was the first academic program that I ever, just had to recognize that everything I did was applicable. There wasn't a course, there wasn't any content or anything that I have not used. Everything, and there's just such a broad study that's in this. As I also look at the DBH as a form that brings pretty much dissolves the silos between LPCs and LCSWs and MFTs and all these different schools of thought, and bringing us all together. This is one of the really degrees that brings everyone from every background together, instead of operating as, in silos as individuals and pretty much, just sticking to your groove according to school. But basically the DBH, the future is bright. The demand is strong. There's a huge need for DBHs in primary care settings, in specialty care settings, federal qualified health centers. We policy, entrepreneurship. The sky is the limit. I have had great opportunities. Everything, all the doors open for me becoming a DBH. So Dr. Cummings' vision was amazing, and so being a part of CGI has helped me continue the legacy of Dr. Cummings. If it wasn't for Dr. Cummings, I would not be in the doctorate program, period, nowhere. This was the only program that spoke to me. DBHs are very unique people and peculiar people, of being disruptors and being critical analytical thinkers of the healthcare program, and giving me the skill sets. We gain those skill sets to be able to voice, no matter who's in the room. It could be the most astute politician. It could be the most astute medical provider. We have the courage, we have the information, we have the background, and we have the research and everything to really back up what we're saying. And these folk are looking for leadership. They're looking for leadership, but as a DBH, in deciding to become one, that was the groove, that was the pathway that gave me all that I needed in order to really just broaden myself in so many different areas, from finance to practice, entrepreneurship. I mean, I can go on and on. I'm a big Nick Cummings fan. Anybody that knows me, and I'm very appreciative that he created this degree. If he did not create this degree, I would not, and I repeat, would have not pursue any type of doctoral experience. But boy, oh boy, what type of experience has been becoming a DBH.
So I've written in the email inviting some of you to join that you would learn today what CGI is doing to help support that disruption of healthcare and improve healthcare, and how your support can help. And please don't think that any donation is too small. $1, $5, that's good. We'll take it. And I would like anybody who thinks that you could do that, talk about how that donation has had an impact on the students. I could tell my experience. Like I said, this donation allowed me to take summer classes because, during the regular term, I could break the bulk of the payments into small installments, but in the summer, it's pretty much all at once. And that scholarship helped me to take summer classes because, having that scholarship, I did not have to pay the whole bulk of money at once. Otherwise, I probably would still be in school because I would have to take fewer classes, every semester. So to me, it was a great impact. And that's the reason I'm here supporting this institution. And I want you all to support. So would you guys please talk more about what other impacts, other stories that people can see the impact of this institution in people's lives and in general?
Sure. I know, Dr. Young, you wanted to say something. Do you mind if I say something that relates back to what Dr. Baldwin was saying about DBHs?
Yeah.
So I loved what you both said. And Dr. Grant, when you were talking about DBHs being peculiar people, I was like, yes, that's exactly. And I was listening to a podcast earlier today, and it was about just, kind of from an operational standpoint, how a lot of people, it was actually a Brene Brown, and she really specializes in vulnerability and being a whole person. And it's, kind of like her Dare to Lead podcast. And she was talking about how in daring organizations, leaders say, bring your whole person to work, bring your whole self to work. And that's what we ask our students to do. We ask that of ourselves, which can be scary and uncomfortable for us, as well as, for our students, because we have hard discussions and courageous discussions that need to be had that won't happen elsewhere. But we also provide the space for you to feel safe, bringing your whole self, and that's part of our culture. And so what that does is it really allows for the creativity and the innovation to flow, because, when you're kind of armored down, like Brene Brown talks about, armoring up as a leader, it closes off your heart, and that shuts down creativity and the, willingness to take a risk. And so if you fail, so what? Try again. But you have to try things that have never been done before. And if people feel like they don't have the space to make a mistake, to try something really peculiar, then what the heck are you going to graduate school for? What are you getting a doctorate degree for? And I think, I was kind of feeling that when you were talking, Dr. Baldwin, because that is exactly how I was feeling when I was looking for a doctoral program. And so, like you said, if it wasn't for Dr. Cummings and the program that he created, you wouldn't have gotten a doctorate degree. And I was exactly the same. I actually got a master's degree thesis when I was an undergraduate in the honors program that came, was a really heavily research-oriented PhD pathway program at ASU as an undergraduate. And they eat their young.
Throw right quick, man. Get this
I hear
light.
you. I hear you, Dr. Grant.
I'm showing you throwing right quick. Get this light, man.
Well, he's there. He's having a hard time though.
Oh, we hear you.
Okay. Just gonna text him. We can hear you. But yeah, I really liked what he said about that, and just the idea that the program is really here for the whole you. And so, Pamela, like you've been saying in the chat, and Pauline, like you've been saying as well, it really is about, and Miriam, as well as you, it sounds like you have a really good specialty in pediatrics to bring to the table. And being a BCBA, I think Lily has really trailblazed, and she has been bringing BCBAs to our program because there is so much exciting opportunity as a DBH. So I'm going to shut up now. Dr. Young.
Just on one note on that, about the BCBA part, next term we have a class just on integrated care for autism. I don't know that any other school has that. Dr. Young.
All right, thank you. Well, now that Dr. English has mentioned it, I will say that one of the things that I try to do, I actually teach one of the first courses that students are required to take. So it's one of the prerequisite courses for all of our other courses. And so that's DBH 9901. And so in that course, on the first day, what I try to do with my students is let them know, if you have kids and they come on the screen, it's okay. If you have a spouse or a partner and you need to talk to them, it's okay. If you just got in from work, because sometimes that happens and they're rushing into class and you need to eat dinner, it's okay. I don't want you in class not eating. And so just touching on that with Dr. English, that we want you to bring all of yourself, so your whole self. We're not proponents of coming in and just acting like, everything is great and everything's perfect. You had a hard day. It's okay. And so even at the beginning of class, I try to do a check-in with my students, make sure that, hey, how are you doing out there? How are you in the field? What's going on? Because the students that we have are professionals. They are in the field. And so we can't just act like they're just students. And so you guys said, typically they have whole lives. They have things going on. And so again, just that connectivity and allowing people to just be who they are when they are in the program. And also as an employee of CGI, always feeling the same exact way as Dr. English said. And I just feel like that's so important. And that's what makes us so unique. So one of the things that Dr. Rocha asked about was, what are some of the opportunities or spaces that DBH is fit in? And I will just use myself, for example. I was an LMSW, which is a licensed master social worker. And so that's an associate licensed social worker for about, I think, 7 years. And then I pursued my LCSW, which is licensed clinical social worker. And I entered the Doctor of Behavioral Health program with the intention of, I wanted to train people and I wanted to teach them how to implement integrated care. And so I was like, I have to get my doctorate degree to do that. But when I found out what a DBH was, it changed my whole purview of what I wanted to do. And so at the time I had a private practice, and earning my DBH led me to change my private practice in the way in which I practice. And so initially I was just providing therapy, and I would, review certain reports from maybe a medical practitioner if they, if my patient decided to bring them in. And then when I got into the DBH program, I realized that integrated care is something that has to be there. And so I had to change the way in which I was operating. And so I formed a partnership with a primary care doctor. I formed a partnership with a chiropractor. I formed a partnership with, just different healing practitioners, yoga instructors. And I would start bringing them into my private practice and holding these classes for my patients to come to and for them to come and ask questions. And it just opened up my whole view and my whole vision for my private practice. And so still to this day, I have other practitioners that I consult with. Not too long after that, I decided to, as a part of my program, I had to intern. The practitioner wound up wanting me to stay on. And so that was a great experience within itself. And so again, it just transformed my view of how to treat my patients. But then on another note, after getting my DBH, I found that there were a lot of consulting opportunities. And so I sought those opportunities, and I found that there were a lot of private practices, a lot of practitioners that had no clue about integrated care. And so I created a whole company around consulting and was able to get contracts going in and transforming those places, those medical centers, those private practices, those primary care practices. And it was great, and I loved it, and I still do it. But I fell in love with it, and I was like, wow, they didn't know this stuff. But guess what? I acquired this skill that not a lot of people have, and I can now help others to make sure that they are providing effective quality care, real effective quality care. And so going in and teaching doctors how to integrate their practices, how to bring in behavioral health practitioners, and then training the behavioral health practitioners. Hey, these are the things that you need to have in place to work with this primary care doctor. And so it's just been really great. And I think just as a DBH, again, the policies, the procedures, I've done that. I've had to write those. I've had to go in and do budgets. I've had to go in and train staff. I've had to fire staff. And so just on the entrepreneurial piece, I have found a way to really, really take hold of that. And I think it was Pamela that mentioned it about just being able to integrate the two pieces, your practice portion and then your entrepreneurial portion. And so as a DBH, I have definitely found a way to do that. And we try to teach our students how to do the same thing. And so I'm always encouraging my students to consult. Dr. Rocha, I encourage Dr. Rocha to consult. And I remember her being on the phone. She was like, I'm not a consultant. And I was like, yes, you are.
And it's pretty much all I do now.
And that's what she does now. And so, you know, I just wanted to put that out there because if you are interested in, you know, the practitioner piece, that's great. We love that. But just know that there's room for other parts of healthcare for you to be in as a DBH as well.
And I want to add to that, Dr. Fanike, that I think it's a very rounded education because we are entrepreneurs, yes. We are practitioners, yes. And we are researchers. Mm-hmm. I know during my school time, I published papers and my students now are publishing papers.
Yes, that's a huge push. We have to get
in school.
Yeah, we have to get what we're doing out there.
Healthcare, you know, it's like you disrupt from every angle, mm-hmm. from the practice, from the policy, from the research. Mm-hmm. And this is why this is such a unique, you know, institution. And please donate.
Yes. Yeah. Thank you for the reminder on the donations. So a question that you had also asked, Dr. Rocha, was how did the scholarships, you know, kind of benefit students or some other stories? So a couple of the students, almost every student uses them directly to support their tuition, and 100% of every single donation goes directly into student scholarships. So we don't use it for operations. Or, you know, facilities or anything like that. It goes all to our students. And this is also part of why and how CGI was founded. We have always wanted, and the Cummings family and I, when we, you know, started to really look at how much are we going to ask for tuition, we knew that the amount that we ask for tuition is not in and of itself going to make the institute self-sustaining. But we knew that if we were innovative enough and we were able to attract the right students, that they would be able to graduate without debt. And so I graduated from my Doctor of Behavioral Health program with a lot of debt, and it took me a long time to pay that off. In fact, I was still paying off some of my master's degree loans when I took on the Doctor of Behavioral Health degree. And that's just something that we didn't want our students to have to negotiate because we knew that there was a ton of evidence. And I remember looking at the evidence with Dr. Nick and Dr. Janet and saying, the evidence is very clear about when students graduate with debt, they cannot be entrepreneurial. They cannot take risks. They have to look for that job. Even though they're a square peg looking for a round hole, they're looking for that income to help them pay off those loans. And so if we can at least keep tuition low enough for students to be able to work full time and then, you know, have reasonable expectations for the work that it takes, it's kind of like taking on a part-time job, and then finish the program without debt, then they can go and launch their businesses. And like, you know, Dr. Rocha and Dr. Young have said, be that consultant. I do a lot of pro bono services here in the Arizona community. And part of that is because of I'm fortunate, the job at CGI allows me to serve as a consultant. But I also started my own business called Tara's Place because my specialty is maternal mental health. And so I started a business, an integrated birth center practice with certified nurse midwives here in the Valley while I was, you know, growing CGI. And so it really is doable. It can make you crazy, but you just have to remember you get to choose the amount of crazy and the amount of chaos. And if it gets to be too much, like it did for me in 2020, I needed to step away from that practice. And so now I'm just continuing on at the state level and with nonprofit organizations serving on boards and in an advisory capacity. Every single state Department of Health is in an absolute state of chaos right now due to COVID. We have a student who graduated a couple years ago, and then he joined the epidemiology team at the New Mexico State Department of Health. And what he went through as an employee and the experience that he had telling me with all of the other employees, they had almost 100% turnover in just 1 year because of the stress and strain that they had by having to divert all of their staff to 100 different new tasks that no one had ever had before. And so state departments of health are, I can't even think of the right word. It's so beyond the word desperate, but it is really and truly, they are just in need of people with the skills and expertise, as well as the leadership capacity with a heart that we have as doctors of behavioral health. And so there just is no limit, and the world needs us so badly. It doesn't necessarily know yet. And sometimes I get questions like, oh, well, I've never heard of the DBH. And, aren't you worried that nobody really knows your big secret? And I'm really not worried about that, because every single time we have a new student come in, every new group of students that goes out, we're graduating between 1 in Dr. Rocha's case and 5 in our upcoming class that's getting ready to graduate in June. Students at a time, but every single one of them is making such a huge, enormous impact that it's not going to be a secret for long. And I had an excellent experience a couple of weeks ago when I attended a national forum on maternal mental health, when in one of the panels, I was really impressed by one of the speakers, and I looked at her bio, and she was a DBH. She graduated from the ASU program. I connected with her. Dr. Fanike and I are going to meet with her later in April. And, it's just really exciting to see doctors of behavioral health. She, in fact, is a person who's been working in the insurance industry to integrate care bundles and value-based contracts behind the scenes from the health insurance standpoint. So lots of doctors of behavioral health are clinical, but to be at that level executive-wise within a health system can also create, from the other direction, lots of innovation and change and opportunities. So
on that note, I think it's amazing. It's really important to continue this funding going, because the fact that we can support students from diverse background and keep people who are working full-time in a doctoral program allows the DBHs, when they graduate, to have a different perspective and to have a different angle on how to tackle certain problems and the importance of certain problems that in other degree programs people don't look at. We understand very, very well what is health disparity and, access issues related to access, patient experience, and so many things that have a huge impact on the patient outcomes, and also on the results, the financial results for institutions. So it's important that we can bring these diverse students to the school so that they can go back and make changes in the system.
Yeah. Rural and remote areas is one area that I'd like to see us increase our diversity of enrolled students, because I remember doing a study when I worked as a staff member at a university, and we were looking at the education and the higher education going, college going rates. And we had to look at certain counties. And in the state of Arizona, the northern counties are very extremely desert rural. They're high desert rural. And some of the counties only had, and we're talking about a landscape of the state of Arizona is a big state. So think of the northern half and the eastern corner of Arizona only having one pediatrician in the entire area. And it was down towards the bottom of the corner. So if you're living at the Utah border, you're not getting care from a pediatrician. So here I'm thinking, I live in Phoenix. We have hundreds and hundreds and hundreds of pediatricians. And I'm thinking, what if I didn't have, and I have a son, so I'm thinking, what if I didn't have a pediatrician to answer those questions when I became a new mom, and, to reassure me on, everything from lactation to baby care. And, it's the lack of those specialties that really leaves a huge kind of black hole in rural and remote areas. But if you put a DBH there, it's like, just a magnetic, pulling together of community resources and, really community grassroots kinds of efforts, getting people to work together to really meet the population needs, provide telehealth options, if those are even possible for the populations that are, seeking care. But you get a DBH there and you're looking at really innovative solutions. So One thing due to the pandemic I want to talk a little bit about just for a second is that our students this year have also experienced a lot of hardships. And so, many of them have had COVID themselves or have had to either take a break or a leave of absence from school for a short or a longer period of time so that they could do caregiving for family members. Some of them lost employment, some of them lost, in addition to employment, some of them lost housing or, had to move into different situations or needed to change, lots of different hardships. You can imagine economic hardships. And so the Arizona Gives funding that we're doing this year in 2021 is aimed at really building a student emergency fund, because we have students who, for no other reason than I can't pay my tuition bill this month, leave our program. And that breaks our hearts because we see all of the potential. There's not a student who gets through our doors who we don't know 100% will be successful. So those who leave the program, it's really primarily either financial or just a complete, something really big happens in their personal life that causes them to either have to take a leave of absence or to not be able to be part of the program. And so our Arizona Gives Day and our campaign it will last the whole year long, and it will go towards helping students who are in those situations not have to drop out of school. And it's not the only fund that we have. We also, and Dr. Rocha, you can speak a little bit to this, we offer what we call resident or research assistantships, as well as teaching assistantships. So Dr. Rocha, I believe you did that at least one term.
Yeah, actually more than one term. I was a research assistant once and a teacher assistant once also.
Yeah, and so the structure of those programs is to reduce tuition for the student during that term by half. And so our tuition is already low, and then we are able to lower it further because it supports you in the passion and the work that you're trying to do. So if you're researching a new topical area, Dr. Young mentioned suicidology and a couple of other examples. So if we have a student who happens to be kind of an expert in that area or has a lot of experience in that area, we have those research assistantships or teaching assistantships that are available to help one of our instructors or one of our faculty members further develop that concept or a module on an emerging topic such as COVID-19 and trauma, or such as suicidology, or many, many other examples. And then the teaching assistantships, every once in a while we'll have a faculty member who's just a wonderful subject matter expert, but due to their own career or life, circumstances, they really need help. Somebody there who can really kind of do some of the administrative tasks behind the scenes. And so those are options as well. A lot of times that gives you a great opportunity to interact with your other students, as a peer, but also as a leader. And so we're always looking for those opportunities to put current students in leadership opportunities, and to give you opportunities throughout the program to really grow and stretch outside of your boundaries. So you may not come in thinking, I'm a consultant or I'm an entrepreneur, or you may not know exactly who you are coming in, but you will definitely be a different person when you are leaving the program. And then we hope that you stay in touch with us forever, because we kind of circle ourselves around everybody who comes through our doors and call them our people.
Yes. Well, guys, thank you so much for joining me today. Thank you, all of you who attended live, all of you who are watching the recording. Please click that link. It's good for a year.
Mm-hmm.
We need help to keep this work going. And thank you so much for your presence today. Share the link, share the goods. See you next time.
Thank you.
All right.